Hi, you guys. Welcome back for our daily practice questions. It is day 31, and as always, y'all know I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock, a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Now, these questions for today is just going to be a mix of a few respiratory things as we tie up our respiratory sessions section, I should say. Um, because it's about to be February and we're going to go straight into cardiology because it is heart month and you know I love cardiology. But anyway, let's get into the respiratory stuff and then we'll talk about all that in a little bit. Question number one. A 65-year-old male with a 30-pack year smoking history is diagnosed with moderate COPD. He presents with shortness of breath and a chronic cough. What is the best treatment for this patient to improve symptoms and reduce the risk of exacerbations? Is it A, inhaled corticosteroids, B, a LABA, C, a combination inhaler with a LABA and an inhaled corticosteroid, or D, oral corticosteroids? Take a moment and tell me what you got in the comments, y'all. All right, so y'all know I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. So here the stem of the question states, what is the best treatment for this patient to improve symptoms and reduce the risk of exacerbations, right? All right, so again, if they're asking for a treatment, you know I always tell you to run it back and look and see if they provided you with a diagnosis. In the event that they have not, you need to run it back a step further and look at those assessment findings so that you can determine a diagnosis because we got to know what it is to be able to treat it, right? But it has been provided here, lets us know that this patient has been diagnosed with moderate COPD, right? So, how do we treat moderate COPD? Remembering your gold stages. Stage one is your mild, right? Stage two is your moderate. Stage three is your severe. Stage four is very severe. So we're looking for stage two. So in stage two, you add in a long-acting beta agonist at that time, right? Your long-acting agent. So your best answer here is B, a LABA. And y'all, again, make sure y'all are studying those medicines. I'll try to add that into the rotation of going back over there. I do have videos where I have gone over medicines, but to keep it in front of y'all, I will do that as well. I know some of y'all reached out about the ebook stuff because I do have a list of them in there, but bear with me. I'll do a video on some of those soon. All right, question number two. A 68-year-old female presents with a fever, productive cough, and difficulty breathing. She is diagnosed with community-acquired pneumonia. She has no known drug allergies. What is the first-line antibiotic treatment for an outpatient with uncomplicated community-acquired pneumonia? Is it A, azithromycin? Is it B, ceftriaxone? Is it C, amoxicillin and clavulanate? Or is it D, levofloxacin? Tell me what you got in the comments. Tell me what you got. All right, so the stem here states, what is the first line antibiotic treatment for an outpatient with uncomplicated community acquired pneumonia, right? So this stem tells us everything. So this is somebody with uncomplicated community acquired pneumonia. We want to know how to treat. What you can pull from this scenario and the full portion of the question is that there are no known drug allergies, so we don't need to eliminate anything based off of that. But your best answer is A, azithromycin. Y'all know first line therapy options are your macrolides, and you can also utilize high dose amoxicillin. But you know, since the beginning, Macrolides have been our first line therapy. Remember, macrolides end in myosin. Azithromycin has always been that first line therapy for community acquired pneumonia. Now, I tell all of you guys, and I was just discussing this in my 5-week course, but um, azithromycin, when you think about it, aka a Z-Pack, people always come in and they want the Z-Pack. And this has become a thing in I don't want to say a trend, but it has been overused. So there's cause resistance, a higher resistance rate. So that's why they started utilizing other things to aid in treatment. And high dose amoxicillin is now a additional first line therapy option. So for board's purposes, if you see azithromycin or high dose amoxicillin, those are both options for first line therapy. They will never put both as answer choices unless they're giving you a way in the scenario to eliminate one or the other, right? So I just want you to know that so you can keep that in your mind. So if you see it, then you know, okay, like, yeah, she did say that, right? But in this case, azithromycin is your best answer, okay? All right, and one more. Question number 3. A 28-year-old woman presents with a history of asthma symptoms, including wheezing, shortness of breath, and coughing, which occur several times a week and are triggered by exercise and allergens. She reports that her symptoms have been affecting her daily activities and sleep. Her current treatment regimen includes a low-dose ICS plus LABA combination inhaler, PRN. Based on her presentation, which of the following is the best treatment to help control her asthma? Is it A, SABA as needed? Is it B, a low dose ICS plus LABA daily? Is it C, an inhaled corticosteroid alone? Or is it D, a medium dose ICS plus a LABA? Take a moment and tell me what you got. All right, so stem of the question here. Based on her presentation, which of the following is the best treatment to help control her asthma? All right, so y'all know I tell you if they're asking for a treatment, determine if they're giving you a diagnosis. In the stem, they are telling you we're talking about asthma. But it also lets you know that we need to look at how she's presenting to see how we want to adjust treatment, start a treatment, etc. So that's what we're going to work our way through, okay? And I know I'm talking through this and y'all probably like, duh, girl, we know this. But I say the steps so that in your mind you can start to practice the steps so that when you're on boards and that's when our anxiety and all the things kick in, that you can, and all the overload of information that we know we're like processing through, I want these steps to be so second nature that you are able to do it under pressure. You know, when you practice and you do anything no different, like if you're in the gym practicing basketball and you're practicing your shot and you're doing all the things, then when the pressure is on, you're more likely to be successful, right? Because you're used to doing this. This is second nature. This is muscle memory, right? So I say all this stuff, but there's a method to my madness and I'm saying it for a reason. But so trust me, but anyway, a 28-year-old woman presents with this history of asthma symptoms. She's having wheezing, shortness of breath, and coughing, which occurs several times a week, and it's triggered by her exercise and allergens. And she's currently on a low dose ICS and LABA combo inhaler PRN. You know, we use that in step 1 and step 2, right? But she is having symptoms, uh, they're affecting her daily and she, let's see, several times a week, right? So that lets you know that we are now to that third portion where it's not less than 2 days a week. You know, we have exceeded more than a couple of times a week. So now we need to be to that phase, stage 3, where we start the ICS plus the LABA daily, right? So B is your best answer. Also, something that you can look at is that, hey, she's already on the ICS plus LABA combo inhaler as needed, and she's having way too many symptoms. So this is clearly not managing her. So we need to bump up the stepwise approach, right? Which would mean to take her from the low dose as needed to the low dose every day. Okay. So I don't want y'all to overcomplicate it and just walk your steps through because truthfully, I think we get hung up in the fact of how many moving pieces and parts and how many medications you could potentially do. But if I was just to ask you, say you didn't know anything about medicine and your child had any of these things going on, your step would be, okay, well, this ain't working. I need to give, more of this. I might need to stay on top of this more. So I want you to use that nursing judgment that you already have as you process through and just walk through the steps. Okay. Don't overcomplicate it. All right, you guys, I hope you found this helpful. Y'all have done amazing with the respiratory section. I'm hoping that this has helped you to tie things together a little bit more and help you to apply it. Keep doing this. Again, repetition is the key to retention. And like I mentioned earlier, now we're going to start moving into the cardiac questions. So y'all get ready for all of that stuff. But as always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all make sure y'all meet me back here. And if y'all need any of the resources that I do offer, feel free to reach out to the Nursing Studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to the Nursing Studio, the number one at gmail.com. All of the things that I offer are linked in the bio of this channel, including my website. But if you're looking to book any of my one-on-one sessions or my custom packages or plans, I always say either call, text, or email so that I can gauge what you truly need to make sure you're booking the appropriate session type, okay? All right, y'all know what to do. Make sure y'all meet me back here. Happy studying. Bye, y'all.